Week 4, Fuji 9, glass ionomer. Glass ionomer is used for Class 5 restorations, occasionally a Class 3 restoration. Its purpose is for patients that are caries prone, so it is fluoride releasing. It has the property to chemically adhere to the tooth. It has ionic exchange, so it bonds to the tooth. This also, like flowable, should not be used in stress-bearing areas, so not any adult posterior class 1 or 2 restorations. It is hydrophilic. It likes a wet surface, so it is an excellent material for working close to the dentin or any areas where it's near the gingiva, which has a lot of moisture, so it's very compatible. The material we're going to be using today is a self-cure. It comes in these nice little pre-packaged containers. It does come as a powder and a liquid that you can mix with a spatula, but this one's really neat. It has all the powder and the liquid all in one. You just depress the little plunger and put it in the activator gun, and you can extrude it right straight into the tooth. Again, it's self-cure, so once we start mixing it, it requires that we have 2 minutes to place it in the tooth, shape it, and then don't touch it. You can apply a conditioner to the tooth preparation prior to placing the glass ionomer. This helps to remove any of the smear layer. It helps adhesion and bonding to be just a little bit better. However, this material does not have to be used with a conditioner, but I am going to demonstrate it with a conditioner so you can see what that looks like. So it's just 1 drop of this bottle of conditioner, and it's kind of a pretty green color. So when you place it in the tooth, you'll be able to see it really well. I just have 1 micro brush, and because it is just a conditioner and not an adhesive, it will require taking it over to the sink and rinsing it and then drying it. So maybe have a wet cotton roll and a dry cotton roll for your lab experience. So let's take a look here. So we have a nice class 5 on number 30. So I'm going to place that right into the cavity prep, and then you just want to really scrub that in there for about 10 seconds or so. And again, when you're transferring this to the operator, you're handing them the micro brush, and have that dap and dish handy because they're probably going to go back and forth into that cavity prep a few times. Okay, really scrub it in there. Then have a cup of water and really rinse that out. Okay, rinse, 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 and then dry it out as well. Again, it's not as crucial with this material that we have a perfectly dried surface. Remember, it's hydrophilic, it likes water. So we want it to maybe glisten a little bit, but we don't want to leave pools of water in place. Okay, so the next step then is mixing the capsule. So you always want to kind of tap it around to loosen any powder, just like we shake the bottle of powder, we're just loosening the powder inside of the capsule. Then this plunger at the end, just like our Eon brand 2-spill amalgam, we're going to push this in. So I'm going to set it on the counter and press it in. But you see, it's not fully depressed. So I must place it into the extruder gun, and there's a little groove on the capsule that slips right down in, so you can load it. Then grabbing the handle, give it 1 click, and then there's a button that releases the plunger. Then you take it out and you put it into a different mixer than you mixed your amalgam. So this material you mix for 10 seconds, so I have it preset. The pink button is the start and stop button. They're not separate buttons. Go ahead and lift the lid. If you need directions on how to load it, it's built right in here. But you load the tip on the movable part of the mixer. So put the tip through the hole and then you just turn and snap the capsule into place. Make sure it's in, click it down. It won't go if you don't click the lid. It knows not to do anything. So make sure you click it down, hit start for 10 seconds, then open your lid, then it rotates back out just the way you placed it in. I'm gonna move that back to the side. I need my extruder gun to apply it, so I'm going to place it in, and then you want to give it 2 or 3 clicks, and then you'll see the material start to come through the tip, okay? Now we can go either to the patient's mouth or hand your extruder gun to the operator. They'll take it from there. Once you have handed them the extruder gun, be ready with a composite instrument so that they can contour and shape it. They don't have as much time with this material as they did with the flowable composite. So it goes right into the cavity prep and give it a little squeeze. And then you want to come back through with a composite instrument, which I've lost, but I'm just going to use the back end of my cotton forceps here to get that initial shape and remove any excess. And you see I'm putting all of that on my glove. That's when you work alone, you have to do the best you can, but if you're chairside, you have that 2x2 handy so you can be wiping off their instrument for them. So this material will not be as pretty and shiny. You can see already the difference between the buckle of 29. It's gonna cure and set in a more matte color. So oftentimes an operator will have a clear coat varnish type of application that they put on after it has fully set. So after the 2-minute cure time, they may paint this varnish over the top of it, and that's a 10-second cure. That gives it a little bit more of a shine, and it helps maintain that cable surface margin over time in the patient's mouth. All right, that is it for our glass ionomer Fuji 9.